This is our running analysis presentation, and our group members are Yichun, Yuting, and Rithi. In our running gait analysis, it is the systematic observation of movement patterns during running. It is commonly used to improve performance and reduce injury risk. Inefficient mechanics can cause increased stress on joints and soft tissues, leading to overuse injuries. This analysis focuses on lower and upper body mechanics using slow motion video. All running for Rithi is at speed of 8 miles per hour. Foot landing type appears to be rear foot. Rear foot strike can cause overstriding and more load on shins, causing shin splints. Midfoot strike is preferred for minimal injury. Hence, can be corrected to midfoot by increasing cadence, maintaining tall posture, aligning ears, shoulders, hips, knees, and ankles vertically, engaging hips and glutes, and improve arm swing by driving elbows back to help light leg cycle faster, and for it to land underneath directly. There is slight overstriding that is present in both distances of 1 km and 2 km. If overstriding persists, injuries like hamstring strains, medial tibial stress syndrome, patellar femoral pain syndrome, and plantar fasciitis pain will occur. And to correct overstriding, along with the aforementioned foot directly under the hips, increased cadence, and quieter landing, there are additionals to be added that are feet contact time to be shortened, and the tilt should be slightly forward from the ankles of the leg. From the full body back view for both 1 km and 2 km, the landing foot contacts the ground close to the body's midline, indicating a narrow step width and a crossover tendency. If crossing over prolongs, it creates stress on outer hip, known as the id band, shins, also known as the tibial stress fractures, knee pain, and lower back pain. To correct this, cadence is to be increased, and she should aim to run wide by visualizing a middle line and making sure feet lands outside of the line of their respective sides and not on the line. A trunk lean angle indicates a near upright posture and good trunk control during running for both the 1 km and 2 km distances. The landing limb for both 1 km and 2 km distances run by Rithi demonstrates a knee flexion angle in both distances that indicates an effective shock absorption during landing. The trunk lean for both distances indicate a near upright posture and good trunk control during running. At mid stance, Rithi demonstrates a near neutral knee valgus angle for both distances, indicating good knee-foot alignment and frontal plane stability. In the front zoomed version, the short blue line below joins the ankle to the heel. Rithi demonstrates near neutral knee-foot alignment and good frontal plane control again during the stance. At mid-stance, the pelvis remains relatively level, indicating good pelvic stability and hip control during running from the back view. Again, from the back view, the horizontal reference lines indicate minimal vertical displacement of the head across the gait cycle, suggesting good control of vertical oscillation and limited head bobbing, which is good.
Thank you, Rithi. Now I'll talk about my run analysis. So starting with areas with correct running form, from the front, we can see that my shoulders are level and the head is held high. This shows good upper body control and prevents the torso from collapsing under the weight of the stride. My knee also does not cave inwards during the stance phase of running, which indicates good knee alignment and lower limb stability. From the back, you can see that I exhibit a neutral base of support, where my feet land on parallel tracks rather than a crossover gait, which is like a tightrope. This indicates sufficient lateral stability and reduces the hip adduction moment at the hip. From the side, you can see that I maintain a consistent 90-degree approximate elbow bend, and in the picture it is 77 degrees, so about close to 90. The arms and motion is compact, which helps maintain a steady rhythm without wasting energy. We can also see that I have a balanced forward posture in running, which refers to the slight forward lean from the ankles, with the head, shoulders, hips, and feet remaining aligned. This posture indicates efficient alignment of the center of mass over the base of support. Some areas of improvement can be overstriding, where my foot lands too far in front of hips, evident heel strike, where my heel makes first contact with the ground ahead of the body center of mass, vertical oscillation, where the runner has a more pronounced bounce and my head moves up and down significantly. This indicates they are pushing off the ground vertically rather than driving forward, and is not ideal because it signals inefficient mechanics and can increase energy cost and injury risk. Moving on to pronation of my feet, from the back view, you can see that I show mild to moderate pronation during the stance phase. My heel shows a slight inward tilt and the Achilles tendon deviates marginally from a vertical alignment, which indicates controlled inward rolling of the foot after ground contact. However, the pronation observed is within a normal and functional range, which contributes to effective shock absorption rather than indicating overpronation. My degree of pronation does not appear excessive enough to significantly disrupt knee or hip alignment, and therefore is unlikely to pose a high injury risk if consistently controlled during running. Some injuries that could occur if not corrected is Achilles tendinopathy, which is caused by excessive bouncing, where the extra bounce puts more load on the calves and Achilles tendon during every takeoff and landing. Lower back pain, which is caused by excessive vertical oscillation, often causes a slight jarring of the spine upon landing, especially if the core isn't braced to handle the downward force. Plantar fasciitis, which is caused by overstriding, where if the high vertical force is combined with a reaching foot, the arch of the foot takes a significant hit upon landing. And lastly, shin splints or stress fractures can occur through heel striking, as impact is repeatedly absorbed by the knee and tibia, causing splints and fractures. Reduced shock absorption can also place stress on ankle and hip joints. Lastly, how do we correct such errors? So there are methods like the ceiling cue, where we imagine ourselves running in a room with a very low ceiling. This helps to stay level and convert the vertical energy into forward speed. We can also practice B skips. The drill teaches us to bring the foot up and then point it back towards us so that it lands directly under our center of gravity. Can also focus on the sound of feet to produce a soft landing and run up a moderate incline naturally, which corrects a bouncy stride and forces better knee drive and glute activation. Can also focus more on landing on the mid-foot strike instead of the heel first contact. Thank you, Yichun. Now I'll be talking about my run analysis. So for my correct form, my arms are actually bent at roughly 90-degree angle and I maintain a consistent swing that drives forward and back rather than crossing the body. As for my head position, I keep my head up and eyes looking forward, which helps maintain a neutral spine and good posture. For my core engagement, I maintain a relatively upright torso with a slight natural forward lean from the ankles, which is efficient for forward momentum. As for the front and back view, there is lateral stability. My legs maintain a straight vertical alignment during the gait cycle. This indicates that my knees are tracking properly and not collapsing inward, which shows good hip and gluteal stability. As for my shoulder levelness, my shoulders remains relatively level and relaxed, which is a positive sign of maintained posture. As for my area of improvement, I'll be going through three of them. Firstly, it will be overstriding and heel striking. The tracking shows that the foot often lands well in front of the body center of mass. This leads to a pronounced heel strike where the heel hits the ground first while the leg is almost fully extended. Secondly would be the rear foot aversion, which is called overpronation. Due to a heavy heel strike, my heels can be seen rolling inward upon impact. This excessive roll is my body's way of trying to absorb the impact that my straight knee cannot. Next, it will be the ground contact time. The braking effect caused by the heel strike likely increased the amount of time the foot stays on ground, reducing efficiency for my running. Next, I'll be talking about likely injuries if these areas are not corrected. So the shin splint and plantar fasciitis, Yichun has already gone through, so I'll just briefly go, you can briefly see. So I'll be talking about the runner's knee, which is actually knee pain, which is caused by landing with a straight leg sends a significant amount of impact force directly into the knee joint rather than allowing the muscles, which is the quads and glutes, to actually absorb it. So correcting these errors to move to a more efficient midfoot strike and reduce this impact on the joints, you can actually increase cadences, which is actually the steps per minute, by trying to take shorter, quicker steps. And by increasing my step count, my feet are naturally forced to land closer to my center of mass rather than reaching out front. Next, we can also focus on drills such as high knees to encourage a midfoot landing and strengthen hip flexors, or butt kicks, which helps with leg turnovers and heel lift. These are our references, and thank you.